cancer is one of those issues that has been a major topic of discussion in Kenya. One, because it's a terminal illness that may not have a way out. And two, because of the cost of just getting that healthcare, even if it's here in the country or abroad. Here on Health Digest, your authoritative health show, we are discussing women's cancers, particularly breast cancer and cervical cancer. I'm Dr. Mercy Korir. This is our fourth and final series on this discussion on women's health. And I'm joined by Dr. Maureen Owiti, who's an obstetrician and gynecologist and a fertility expert, Dr. Frederick Erithia, who is an obstetrician and gynecologist also, and a doctor at Oasis Healthcare. And obviously with an audience who have been engaging us both on camera and off camera on these issues that are really dire and really speak not just to the woman, but to the family unit. Now, on breast cancer is the commonest cancer in women, and it's said that 34 out of every 100,000 women in Kenya have breast cancer. For cervical cancer, it is 25 of every 100,000 women who have cervical cancer. These are the two commonest cancers in women. The third is esophageal cancer, which affects both men and women. And today we are going to discuss issues around breast cancer, around cervical cancer. And I think one of the most important one, we normally think we have talked about it, breast cancer, or we know about cervical cancer. And I'd like to pose this question to Dr. Probably each one of you can tackle one of the cancers separately. And I'll start with you, Dr. Owiti, on cervical cancer. Do we know what the signs and symptoms of this cancer are? What should we watch out for so that one can suspect or maybe think, probably I need to go and see Dr. Owiti, this may be more than it looks?
In terms of signs and symptoms, the saddest thing about any cancer is by the time you have obvious signs or symptoms of the cancer, it's a very advanced cancer. And that is true for cervical cancer. The most common symptoms are women will initially experience some discharge from the vagina. It's really watery and has a very offensive smell. Another symptom could be that when they engage in intercourse, after intercourse, they tend to bleed. They could still have irregular bleeding. They may have pain, and in very advanced cases, they may even develop fistulas, so they could be leaking urine or even having feces coming through their private parts. So, and for me, by the time we diagnose cervical cancer, I want to cry, and I think it's also the cry for Dr. Kairithia, because it means us as the healthcare fraternity, we have failed our women. Because cervical cancer, unlike breast cancer, is a preventable cancer. It's one of the few cancers that can actually be prevented. And it's something as simple as, one, for very young girls, there's a vaccine against cervical cancer. And for those older women already in marital relationships, you can go for screening, whether it's your pap smear or a VI-Vili, and it's through this screening, it's also understanding that the screening, unlike breast cancer screening, we're screening for the cancer. Cervical cancer screening, we are screening for pre-cancerous changes on your cervix. So when you go for that pap smear, we are going to see, are there changes that will actually lead to cancer in the future? We get them, we can treat them before you get cervical cancer. So it's like we have failed on many fronts. Mm-hmm. So it's a very sad thing when I treat a patient with cervical cancer. Mm-hmm. But I think the beauty about this show is I hope I'll encourage young girls to go for vaccination, and for even with the vaccination, you still need to go for cervical cancer screening. So to go for screening, we can prevent a case of cervical cancer.
Okay. Before we move on to breast cancer, probably one of the questions amongst the audience here or the audience at home is, what causes it then?
Cervical cancer?
Yes.
Okay. To date, again, we understand that at least more than 97% of cases of cervical cancer is related to a virus known as the human papilloma virus. And that is the current thinking, that cervical cancer is caused by this human papilloma virus. There are certain strains that are more common. So we have strain number 16 and number 18, but it can be caused by other strains as well. There are other cases whereby we can't really get, but more than 97% are related to the human papilloma virus.
And hence the vaccination.
Yes.
Okay, Dr. Kairithias, same questions, but now moving further up to the breast. What are the signs and symptoms that women should look out for that may point to a possibility of breast cancer?
Okay, thank you for the question. There are quite a number of symptoms, but I must emphasize that, as she said, by the time you're having signs and symptoms, then probably you're discussing an advanced disease process. So typically, it will start with a lump in the breast, and a lump is a definite area of hardness. When you touch against the soft breast tissue, you feel some kind of a bump, which oftentimes is not painful. It is a painless lump, and it can move. When you try to move it, it can move, at least in the early stages. So that's one of the commonest, hence the need for women to occasionally check their breast, because studies have also shown that if women can pick this disease early, you don't even need to sacrifice the entire breast. You just remove the lump, you do a procedure called lumpectomy, and a few other additional treatments, and the cure rate is very excellent. But now, for a bit more advanced disease, you may have pain on the breast, usually unilateral pain, meaning pain on one breast. You may have changes in the skin, whereby the skin looks like an orange peel, very, very rough and inflamed. You may have ulceration. An ulcer means a wound on the breast. You may have the nipple, which is the pointing part of the breast going inside, what we call retraction. Or you may have discharge, abnormal discharge from the nipple. All these things, among others, because it's very hard to enumerate all the signs and symptoms, may most likely point to a disease pathology. Okay. Yes.
Before I engage, I know we have been talking about contraceptives, fertility. Do these at any one point contribute to women developing any of these cancers? Because some conversations I've had it that, you know, if a woman delays childbirth, they're likely to get cervical cancer. Are some of these things founded in any scientific base?
Okay, so if you look, if I take the case of, say, cervical cancer, in terms of the contraception, the issue for cervical cancer is not the contraception. The contraception is just a fact telling us that this woman is sexually active. How does she get the virus? Is through close sexual contact. Now, we've talked about that condoms can prevent STIs. However, this human papilloma virus is very resistant, whereby even condom use, you'll use a condom, but you're not going to be able to prevent getting the virus. So you use a condom, you may still get the human papilloma virus. So even in population studies, you find that more than 75% of the population actually do have the virus. So what makes somebody get the disease? Because not everybody has cervical cancer. What doesn't? Something happens to the immunity. So most people, their immune system is able to battle the virus and not be able to now develop cervical cancer. So again, if you look at, say, HIV, you'll find that in HIV programs, it's mandatory to be undergoing the cervical cancer screening. And the reason is your immunity is lower, so you have a higher chance of developing cancer, and they're actually at risk of developing many other cancers. And that's what defines the stage 4 that you have developed a cancer of the disease. So people's immunity, for most people, are able to battle the disease and they don't get cervical cancer. Okay. So unlike other STIs, you're not going to get it. So you must either get some form of vaccination, and even if you are vaccinated, as long as you're sexually active, we advocate that women go for screening. We can prevent many, many cases of cervical cancer by doing that.
Dr. Karithia, what about delaying childbirth? Does it have any risk to developing, whether it's breast or cervical cancer?
I think the only cancer which has been closely linked with delayed childbirth is endometrial cancer and cancer of the ovary. And there are many theories. Again, it's good to point out that the exact cause of cancer is not known. But there are theories and there are many postulates that have been put forward. In as far as cervical cancer, my colleague has said, Dr. Whitty has said that there is a direct correlation between cervical cancer and sexual activity. Mm-hmm. So it means that people who are not sexually engaged are less likely to get cervical cancer. Mm-hmm. It's also good to point out that the causation of cancer, be it breast or cervical, is multifactorial. There are many factors. Mm-hmm. Issues of smoking, exposure to these viruses, genetics, among many other things.
Let's hear what the audience has.
Nauliza hivi, kwa sababu tunaambiwa, wakati mwingi tulikuwa trained tukaambiwa, hii virus inaletwa na wanaume ndio wako na hiyo mbegu. Je, ni ukweli ama ni uongo? Second, I have two clients who are suffering for. Sasa nauliza hivi, kwa sababu wanasemekana damu ipo chini, kitu inasababisha kila wakati damu kurudi chini. Because kuna time tulitoa damu, tulidonate, akaingiziwa. Then jana tukiwa church, anasema pia amesemekana anatakana tena damu. Ni kitu kinasababisha every time damu yake inaenda chini. Ni kutokula vizuri ama ni nini?
So I think I missed I can't remember the first question. I remember the second.
That they are told. Ndio.
Yes.
Yeah.
Yes.
Means that even my son have it.
Yes. So, what we've said is that this virus, population, both men and women have it, okay? And usually get it through close contact. So you find even people, let's just say, we have homosexual relationships, you understand? You're able to contract that virus even through non-penetrative intercourse. But the most prevalent way is through actual sexual contact. So yes, you get it from your male partner, or let's just say from your sexual partner. The second one was regarding the low blood. Yeah? Yeah. The low blood, if they keep having to get anemic, there must be a cause. And we'll have to go through a history. We start with things like the diet. We start with their menstrual pattern. We start with how are their stool patterns to try to figure out what is the cause. When we do a blood test, it can also be able to give us an indication of what type of anemia it is. So it gives us a direction to go as to what we're going to look for. So advice for your two daughters that if they keep having to be transfused, we have not figured out what is causing their blood to be low. Because if you're able to figure that out, you put a stop to that. I think
she said, did you mean that they have cancer and they're having a low blood count? Or just with cervical cancer? Yeah. And they have a low blood count. I think she's asking, why is it that they have a low blood count and they have cervical cancer?
Part of the problem is they tend to bleed a lot. And so they keep bleeding. So if they have very advanced, and you find there are some people, they even had radiotherapy, which is the mainstay for treatment for cervical cancer. The human body can only withstand a certain amount of radiation or those X-rays. It can't go beyond a certain amount. So if you find it's somebody who's already had a course of radiotherapy, we're not able to repeat another course again in future because you get like the maximum dose that your body can withstand. So because of bleeding, they have to keep being transfused.
I mean, Dr. Kairide, you can add on to this, but I think we look at it holistically and, well, could explain it.
I think cancer is it's an emotionally distressing experience, and it's understandable that mtu atapata mood swings, atakuwa na stress, and one way of manifesting your stress ni kupata a lot of bitterness, resentment, na hasira mingi. So other than giving them blood and support and praying for them, they're also supposed to be given psychological support because they are facing a terminal disease, so that part of it, maybe they could even have physical pain because cancer is a painful experience. So you take care of the pain, take care of the emotional pain, and then take them through counseling, help them to accept the diagnosis.
Let's speak from the gentleman.
Yes, my question is coming through, I'm bringing this question to the doctor here. If you look at in Kenya now, life is changing. Then the death in Kenya now, 7% is coming through cancer. Then we have those people who are affected are 60 to 70%. What does our Kenyan government doing now to reduce that percentage?
Yeah, that's, well, okay.
That's a policy question. I don't work for the government, but at least I'll answer with what I know. One, there's a bill, there's a Cancer Act of 2011, which tries to identify these problems. There's also a clamor in trying to get people access to cheap cancer medication. Since the advent of devolution, we've seen a few cancer centers being set up. So unlike before, where everyone used to crowd in KNH, for example, it is possible to get chemotherapy at Coast General Hospital and all the other facilities. It is a gradual thing, but I trust we need to do more so that we can increase access. Last but not least, of course, no medical worker would want to wait until somebody is sick. So there has to be a shift from curative to preventive through community education, sensitization, screening, and vaccination for those cancers which can be, where vaccine can be used.
And particularly for these women's cancers, because when caught early, then there's what you call a good prognosis.
Yes, I would just, now that you've said that, in advanced societies where they're able to do genetic screening, actually they're able to test certain genetic components and see which women are highly likely to develop breast cancer, so that you offered a choice of removing the breast way before. And this is a practice in the West. I don't think we have that technology here. If it's here, then it's not widely applied. So we go back to the breast examination, mammogram, and monitoring the signs and symptoms.
Okay, thank you.
Okay, my question is it true that blood cancer can make blood cells to eat cells themselves?
Sorry, say again?
Blood cancer can cause blood cells to eat the cells themselves.
Blood cancer or breast cancer?
Blood
cancer.
Okay.
Okay. So it's also really understanding what exactly is cancer. So if you look at cells, okay, cells have what is called a lifespan, okay? So normal cells, you'll have a cell, it's going to be formed, it's going to grow, and at some point in time, it's going to die, okay? Now, in cancer cells, it's like that it's like cells have a program time when they're supposed to actually die, then you get new ones. Now, in a cancer cell, what happens is that it grows out of control, and then that programmed death doesn't come, and now you don't get the new fresh ones that don't have this particular potential. So cancer is like kind of, so it's like you're having an overgrowth. So there are overgrowths of cell which are growing wrongly, and they're not going to die. So they now limit growth of the correct cells which are supposed to have that time. So in that way, you can say it's like it's cooling itself, but it's just they're having an abnormal growth pattern other than what is supposed to happen in nature. Yeah.
Okay.
Okay, first of all, I want to encourage her because my sister is a surgeon in breast cancer, but I just want to let her know that emotional support is very vital. And then the other thing is,
Thank you.
how can you, let me rephrase, sorry. How late is late for the vaccine? Yeah.
Ideally, for the cervical cancer vaccine, the person who's going to get maximum benefit is somebody who has not been sexually active. So you find in Western societies, these vaccines are being given in school when you're 9, between the ages of 9 and 14. It has been a big talk here, and it has caused a lot of fracas because it's like we're saying this is a cancer that's related to sexual activity, and then we now want to vaccinate girls against a disease that you get through sexual contact. So I think it's really just understanding the big picture, that in a normal society, eventually, you would expect that your daughter should grow up and get married and have her own family. They are going to be sexually active in the future. Why not use the opportunity to prevent your child from developing cervical cancer in the future? About how late is late. Initially, when it first came, I think it was being offered to people up to 24 years, but they have expanded. I think even women of 36. Currently, I don't even think there's actually a limit. Having had said that, if you have reached 40 years and your screening is normal and everything, are you really going to get much benefit from getting the vaccine? So, but you feel you want it, there's no longer a contraindication based on age on getting the vaccine.
Okay.
Yeah.
All right. Unfortunately, we're out of time. But we've been having quite a fruitful conversation on women's health, and I want to just give you 30 seconds each to just conclude on women's health. We've tackled menstrual health, contraceptive use, fertility, and today we've been looking at cancers. What do you have to say generally on women's health? I can start with you, Dr. Witty.
Okay. For me, with women's health, I'll just say knowledge is power. Seek it. And seek it from somebody who is well-versed. Don't talk. It's good to talk with your friends and discuss issues that you're having, but when you want knowledge on health issues, get it from a trained professional.
Thank you.
I think my conclusion is women health, it's a collective responsibility for everyone. Actually, it's supposed to be reproductive health because it's very rare to get an issue in isolation. So let's tackle all the issues we've discussed in a concerted manner, and let's explore the technologies and the sources of information so that we can benefit at an early stage. Yeah, and of course break down the taboos and the misconceptions around reproductive health. Thank you.
Thank you. Thank you very much, ladies and gentlemen, for tackling this issue. As you said, it's reproductive health, but we had been calling it women's health. We have been looking at menstrual health in our first series. Our second series, we looked at contraceptive use. Our third series was on fertility. And this final series on women's health was on women's cancers, and we were discussing about breast cancer and cervical cancer. We've been having Dr. Maureen Owiti, who is an obstetrician and gynecologist and a fertility specialist, Dr. Frederick Kairithia, who is also an obstetrician and gynecologist at Oasis Healthcare. We've had an audience who've had a chance to engage the doctors both on screen and off camera to ask questions that have been bugging them, to give their views and their comments on these issues that really affect not just the woman, but also the family unit. We'd also like to hear from you. Get in touch with us at Health Digest at standardmedia.co.ke. You can also tweet us at Dr. Mercy Korir or at KTN News, and we'll be able to engage further on these discussions. Next time, we'll look at a different topic altogether affecting your health. This has been Health Digest, your authoritative health show. I've been your host, Dr. Mercy Korir.